to ensure its sustainability. Well, the authorities have vowed to do all what it takes to ensure that the hospital remains operational throughout.
You are watching Weekend Spectrum. Time to take a look at what's making headlines around the world.
They say many doctors are at risk of contracting diseases from their patients, and there needs to be stronger commitment to reduce the spread of infectious diseases between patients and healthcare practitioners in Africa. Participants say there is a lack of protective and safety equipment in hospitals across the continent.
The most important thing and one of the most urgent issues in Africa is the lack of resources and materials to treat patients. We need resources in order to access better medical equipment.
There is now better equipment that can help doctors avoid accidental injections from taking place to healthcare practitioners who are caring for patients. There is also unique medical equipment that protects patients from picking up germs from doctors. I think that today, with all medical equipment available, we have to promote the need for better equipment in healthcare sector throughout Africa.
As the sun rises over the Fik Zone district in Ethiopia's Somali region, families are retrieving water from a well before it gets too hot outside. Nearby, a group of health workers are packing up their medical kits as they prepare to go out into the field. They are part of a mobile clinic that travels the region providing residents with health care services because there are no local health centers. The United Nations Children's Agency is working with the government to provide free medical services to people here. Shamis Ali Hared has brought her baby Hassan for a checkup.
In this area, we have a lot of problems because of the drought. My child and I were very sick and very thirsty. That is why we came here today.
The majority of Fik Zone residents are nomadic pastoralists, and it's difficult to treat and monitor their health because they are always moving in search of water and pasture.
Especially when there is drought, when people cannot come to the health facilities, when they are moving from place to other place, then it's the only way that we can help the communities that are suffering from diseases, from malnutrition, from other health-related problems.
At the end of her checkup, Hared receives medicines for treating anemia, while her son is being treated for malnutrition. The mobile clinics are not able to offer advanced health care for the people here, but they are providing a much-needed service for Ethiopia's nomadic community. Ted Chaiban is the UNICEF representative in the country.
Thanks to these 24 mobile health nutrition team in Somali and 4 in Afar, hundreds of thousands of women and children have access to basic health and nutrition services. As Ethiopia comes closer to reaching the health MDGs, it becomes increasingly important to reach out to the harder to reach, harder to access population, and this is an essential strategy.
The mobile clinic program began in 2004 with 2 teams and has since grown to accommodate a large number of residents.
Caused by a parasite, a tiny single-celled organism in the blood vessels and livers of human beings. It's a serious disease that disables and kills more than 860,000 people every year. Though 40% of the world's population live in malaria endemic regions, the majority of related deaths occur in sub-Saharan Africa. Despite medical advances, the disease continues to be a problem. It is estimated that every 45 seconds, a child dies from malaria in Africa. But there is hope that one day malaria will no longer burden the people of Africa. Angela and Regina both have daughters infected with malaria. These mothers have come to the Shampande Clinic in southern Zambia to receive medication. Supplying effective drugs within Africa is a challenge. Regina and Angela desperately hope to find treatments for their suffering daughters.
Children are one of the most vulnerable populations to malaria. As you know, in many parts of Africa, people do not easily access drugs in the public sector. They would have to walk miles before they find a public structure.
One of the biggest problems in Africa is lack of health education, which can lead to a lack of malaria diagnosis and treatment. Every year, the